Hey everyone, welcome back to PHAMCAST. I'm Margaret Wallis Duffy, the founder and visionary of Preventative Health Awareness Month End Movement. And of course, this show, which is really becoming the foundation of the place that we get to share stories, education, but most importantly, empowerment, so we can create change in the legacy of healthcare in this country. And you know, I love February because it's Preventative Health Month, and I get to bring FAMbassadors to the table. So for those of you that don't know what a FAMbassador is, it's a healthcare professional or an organization that has put up their hand and believes in this mission that I started, to really change the mindset of Canadians, to help them become the CEO or the hero of their health. And we do that through stocking their preventative health toolbox, coming together, breaking down silos, and bringing all partners to the table, whether that be government, whether that be insurance companies, and everybody in between. So none of this would be possible without these FAMbassadors and their passion. And today, I get to welcome in studio somebody who's become a friend, somebody who is a FAMbassador. This is his first year as a FAMbassador. I hope, and I kind of know, it's not going to be his last. Oh. And he's already helped me to kick off officially Preventative Health Awareness Month 2025 right at the border in Niagara Falls, symbolic of the movement that this mission is having, because we're now spilling over into the U.S. Dr. Dave Harper is in the house, and I am beyond excited and proud to welcome him to our family.
Thank you, Margaret.
And to also tell all of you about him, because he's a remarkable guy, absolutely heart-centered and really about education. So Dr. Harper has been a chiropractor for over 35 years and a sports specialist for over 30. He practices functional medicine and has a passion for neurological health, and particular men's health, brain health, and cognitive health. But one of the things he's most passionate about is helping men become the hero for themselves and their families. He's also the founder of Maverick Health and has got some really cool and innovative tools I'm so excited to share with you, really taking this idea of empowerment to the next level, maybe into the metaverse. So welcome, Dave, to the show.
Thanks a lot, Margaret. I really appreciate it. It's awesome.
You know what? We've had many connection points over the years. I've known your name for a very long time. You know, when you swim, it really is a small circle when you're swimming in a circle of preventative, integrative health professionals. And some of them come from the conventional side, some come from complementary, but you get to know some of the names, and your name has always sort of been in my sphere. But I'd never had the privilege of meeting you personally. And when I finally did get to meet you, it was really refreshing, not only to see how we're aligned in a lot of what we do, but to also, which I love about this movement, learn from you and grow with you and together move this forward. So let's talk about first, before we get started, how did you morph through this thing called your life to get 35 years later to where you are today?
Well, it's important for me to start off by saying that everybody's life is a story.
Yeah.
And what I've realized is that I've actually become like a story Sherpa. Every patient that's come into my clinic over more than 35 years in practice, they've had this story. They didn't realize exactly what that was in terms of the impact of it, and we'll talk about that later with my mom's story. But our lives are stories, and the ability to have memory. So as a young person, as a 2-year-old, I first entered into this world of chiropractic care when my mom had an injury. I grew up in Oakville, and my grandfather, my mom's dad, had been going to see a chiropractor since the mid-50s. And so when he came to Oakville, I was born in 1963. You can do the math. In 1965, we moved to Oakville, over by where the Ford plant is. And my mom had an injury. And so she wasn't getting any help anywhere. So we went to see a chiropractor at the day. He's now passed away, Dr. Jim Barrow. Dr. Jim Barrow had his clinic on Lakeshore right across from the park there, Confederation Park, I think it was called. And so we began as a family every month to get into the car with my brother and my mom and my dad, and we would go, and it was fun. So in grade 8, my health teacher, Mr. Harris, at E.J. James Public School on Carencroft Road, said, I want an essay, I want a one-page, what do you want to be when you grow up?
Right.
So back in the day, we just had Commodore 64, we were using slide rules, we just had calculators come out. I mean, there was no computerization, right? And I didn't want to be a medical practitioner, but I love sciences. So I picked chiropractic. I wish I still had that document. He did not give it back to us. But I entered into grade 9, went to Ophel Trafalgar High School for 5 years, graduated, went to University of Toronto with the idea of getting into the CMCC here in Toronto, the Canadian Memorial Chiropractic College. And I was home. It was awesome. I had a wonderful experience with my classmates, graduated in 1989, and then did a sports fellowship specialty and graduated there in 93 because I loved sports, I loved athletics, I loved testing, I loved the idea of baselines and milestones. And then got involved with a little bit of functional testing. So we had a lab that would measure performance, injured workers. It was called an Archon system. You may have heard that terminology. I was the first one in Canada to have an Archon system. And so back in the mid-90s, I got involved in doing functional testing. They're called FCEs or FAEs, functional ability evaluations, and learned the idea of what it meant to really look at the performance of a person, to look at the way that they acted in their environment, to understand, just like an athlete would in a sport, how the occupational sport was up there or the mental sport being at home. And so I adopted this idea in my clinic about offering people the opportunity to think of life as a sport. And so in the game of life, who do you want to win? Do you want to be a winner at the game of life, or are you prepared to just allow life to beat you up? That's what started. That was the seed that kind of started my road towards this idea of baselines, performance, prevention, proactivity, magnifying, augmenting lifestyle, because an athlete would do that. The athlete wants to win the game. So they're constantly using coaches and various different professionals to help them achieve their best. And so that was how I launched into it. And I studied some mental health things in terms of warrior cultures, what it means to be 10x, 20x, studied Navy SEAL mentality, samurai. Yeah, it's been an interesting journey.
Very cool. Well, thanks for sharing, and you're so right. It really resonated with me that we're all a story, and,
we're all a story.
It's in sharing those stories, though, where in vulnerability.
Correct.
Because not all stories are easy. Not all stories are straightforward, but it's in those stories, if we get to work, that the growth and change can happen. And I think that's what the epitome of this whole movement's about, is really sharing stories in a vulnerable way, in a community and non-judgmental way, but then layering up the tools around you, the support around you, and the village to help you succeed in this thing called life, and at every age and stage of life, which I know, we're going to get into your mom's story, and we both believe very much in health span and healthy aging and the importance of that, especially in a culture where we're living that, it's the young and the strong that are the best. We all deserve to live well at every age and stage of life, and that's the approach you take in healthcare. One of the things I'd love for you to share, because I think it'll set the foundation for our conversation today, is some of the stats, the real stats in this country when it comes to the lack of prevention, this buying into literally waiting till things are broken. Let's put some context around our discussion today so people can really understand the impact that this movement's going to have on the health of Canadians and on the bottom line of our system.
Thank you, and I brought the stats with me because I can't remember them all.
No.
But we do have this perfect storm, I call it, this perfect health storm. So chronic diseases in Canada are responsible for 70% of all deaths, according to Statistics Canada.
Yeah.
That was 2024. I learned back in the late 90s, 1999, 2000, around Y2K, that the first boomer would turn 75 and then 80 in this 2021, 2025, 26 time. So the boomers will start turning 80 years old in 2026. And by 2030, 25% of Canadians will be over 65 years old.
Yeah.
So we're top heavy in terms of age. And what's interesting,
more than 14-year-olds in our country.
100%.
And I found that out when I took my professional designation as a consultant in aging to honor my father, who passed away 9 years ago. And I really talk about stories. Found my dad wanted to die at home, and we were able to grant him that wish. But was it easy, Dr. Dave? No, it was not. And I remember turning to my mom when my dad passed and saying, you know, if it was that hard for me, for us, when I have connections, have some knowledge, what's it like for the average Canadian? And I knew the answer. So in my dad's memory, I was a daddy's girl, and I went back and took my designation as a consultant in aging, and that stat jumped off the page. And here we are, almost a decade later, and we're living it. The system is strained. There's not enough resources. And in other cultures, and I'm going to bring, this is a bit controversial, but I'm going to say it, other cultures revere their aging population. Other cultures surround them and make sure that they're cared for. Not only do we not have the infrastructure, but we don't have the mindset. Not all of us, but the mindset in our culture isn't that. These stats are staggering.
They are. And what's even more staggering is that the average amount of money spent in Canada,
say it, Dave,
per lifetime is up from $220,000 in 2013 to over $328,000 in 2024.
There you go.
This is the strain on the healthcare system. And at the end of life, according to the Heart and Stroke Foundation, their famous 1-minute video, the average Canadian will spend the last 10 years living in sickness. To me, and I know it's to you too, it's unacceptable.
Well, they call it the decade of decline for those that don't know. So we actually have a coined term for it. It disgusts me. The decade of decline, is that really what we want as a society? That the last 10 years of our existence, when we've given so much to our community, to our families, to the world, to be fraught with pain and misery? No. And it doesn't have to be this way. That's why I truly believe, like you said, a perfect storm, that this movement is really taking hold, and it's on fire because people are recognizing that. It's not acceptable.
And we really need to get, as you say, that grassroots kind of mobilization of people, because, and my belief, and I know it's yours, is that we are our own best physician. We're the one that knows it. Whenever a patient comes into my clinic, I will make this statement. We're going to build a bridge between you and myself. I'll never know how you feel. You'll never know what I know. And so as we communicate, as we tell our stories, as we understand who we are, that bridge becomes solid. And as that bridge becomes solid, we will meet halfway if I'm the right person to help you.
Right.
And then find a solution. And then you, as that CEO, that health hero, as I would say, it's your job to determine what you want. Right. And I'm here to support you. I'm here to be your Sherpa. I'm here to help you climb the mountain of you. I'm here to help you be the 10X or the 5X or the 2X, whatever it is that you choose to be. But it's seeing the value in your life and then investing in that value. And so some other stats, you know, we're going to see an issue where the bed space will be, and the cost of bed space will then be determined by your postal code. When my mom and dad moved back to Tillsonburg, which is where my mom came from, she was born there, it was a different type of care. There was a different type of access. There was a different intensity around trying to get that bed space, and therefore the capacity to get it, and then the cost for it. It was completely different. It was country bumpkin care.
Right.
You know, so, and the story is different. My grandfather lived to over 97. He spent the last 15 to 17 days in the hospital, and the last day and a half, he was out of it. Now, he walked every day.
Nice.
He took his vitamins every day.
Yep.
He was the Fuller Brush man in Oakville, Morley Collings. If you're from Oakville and you're watching this show and you know what that was like back in the 70s and the 80s, that was my grandfather, Morley Collings, the Fuller Brush man. So he would park his car and then go door to door with his Fuller Brush bag and have DCW and combs and soap things, and it was all in the basement. Growing up as a kid, I remember going over there and it was all in his basement. He was an entrepreneur, and it was amazing. But my mother spent the last 6 or 7 years in the home with Alzheimer's. And eventually she lost her memory, which meant that she didn't know us, she didn't know herself, she didn't know how to eat on her own, she couldn't chew, and then she eventually passed away about 1.5 years ago. And you know, it's just unacceptable. And this whole cognitive prevention, management, end of life kind of capacity. There's a researcher, James Fries, I'm not sure if our audience will know him, but he first identified back in the early 80s this idea of which Preventative Health Awareness Month is all about, that is the compression of morbidity, meaning that at the end of life you spend the least amount of time in disability impairment that the average Canadian will have, and 10 years is unacceptable on average, some more, some less. But James Fries identified that we could maintain capacity. We could maintain our ability to move and to have life as movement, movement as life for an entire lifetime, so that, as you rightfully say, our health span exceeds our lifespan.
Yes.
It's longer than.
I love that. Well, we've got so much to talk about. We're going to dive in a little bit more about, your mom's story, because I think it's going to touch a lot of people's lives and resonate with them. We're going to talk about the other things that you're going to be doing with FAM, and we're going to address men's health, which is why I'm wearing this t-shirt. When we come back, I'll talk about this and so much more. So stay tuned. We'll be right back here on FAMCAST.